Have you noticed small, subtle changes in someone you love? Changes that feel harmless, yet somehow unsettling. Could these quiet shifts actually be silent warnings that the end may be near? Most people think death in old age comes suddenly, but what if the body whispers its goodbye months, even a year in advance? The signs are often missed, dismissed as just aging until it's too late. But what if you could recognize those signals early enough to truly make every moment count? In this video, we'll uncover 5 early signs the body may show a year before death. Some might surprise you, others may already be happening around you. And by understanding them now, you'll be able to bring comfort, dignity, and peace to someone you care about. Stay with me, because what you're about to learn could change how you spend the time you have left with someone you love. Has their appetite quietly faded away? Unexplained weight loss is often the body's first silent alarm, long before obvious illness appears. While families often chalk it up to age, it's rarely innocent. When the body begins shedding pounds without effort, it's often struggling to absorb nutrients, digest food, or maintain muscle mass. This isn't just about physical appearance. It's about the gradual shutdown of essential systems. Is your loved one eating less, avoiding meals, or losing interest in food altogether? Maybe they say, "I'm just not hungry anymore." But behind that loss of appetite may lie something deeper: changes in the brain's hunger signals, or early impacts of diseases like cancer or heart failure. Even emotional shifts like depression or memory loss can trigger this spiral. The truth is, no amount of high-protein shakes can stop the decline if the body has already started letting go. Instead of pushing large meals, consider small comforts, easy-to-digest foods, and most importantly, presence. Because sometimes it's not about fixing, but about understanding. What happens when even rest doesn't recharge them? Have you seen someone go from energetic to endlessly tired? Not just sleepy, but deeply, overwhelmingly drained? Persistent fatigue and weakness are some of the clearest signs the body is pulling back. It's not laziness, it's biology. The heart slows, muscles weaken, and metabolism shifts from energy production to preservation. Simple tasks, getting dressed, holding a conversation, walking across the room, suddenly feel impossible. They may begin sleeping more during the day, withdrawing from conversations, skipping social events, not out of disinterest but exhaustion. And the emotional toll? It's devastating. Many feel frustrated, even embarrassed by their fading strength. Independence slips away and isolation quietly creeps in. You may want to push them, encourage activity, motivate them back to normal. But the truth is, what they need most isn't more movement, it's more understanding. If someone you love is retreating into rest, don't ignore it. Don't take it personally. This could be the body's way of preparing for its final stage. Instead, offer patience. Treasure the conversations they still can have. And above all, make these quiet days full of peace, not pressure. Are these signs starting to feel familiar? If you're still with me, drop a 2 in the comments so I know this message is reaching the hearts that need it. And don't forget to subscribe and turn on notifications, because the next signs in this series could help you prepare, emotionally and practically, for what's ahead. 3. Is your loved one drifting away, mentally and emotionally? Have you noticed them forgetting simple things, repeating names, losing track of conversations, or seeming confused in familiar places? Is someone you care about slowly withdrawing, not just from people, but from reality itself? As the body begins preparing for its final stage, the mind often follows suit, quietly, gradually, and heartbreakingly. These aren't just slips in memory. This is the brain's response to a body in decline. Less oxygen, slower circulation, and fading cognitive function. What once felt easy, chatting, engaging, remembering, now becomes overwhelming. You might see moments of sudden clarity, followed by deep confusion, a fading in and out, a mind slipping gently into silence, and then the emotional withdrawal begins. They speak less, socialize less. Sometimes they just sit quietly, disconnected from the world around them. But this isn't detachment by choice. It's the brain protecting itself, slowing everything down. You might also notice unexpected mood shifts, irritability, anxiety, or a calm detachment that feels unfamiliar. It's not personality change. It's the emotional side of cognitive decline. Watching this unfold is heartbreaking. It feels like losing someone piece by piece. But this stage is not a time to pull them back into our world. It's a time to meet them where they are. Speak softly. Sit beside them. Offer your presence more than your words. Even if their mind seems distant, your love still reaches them. And sometimes that's all they need. Why does every small illness feel so big now? Have you noticed your loved one getting sick more often? A simple cold turns into weeks of fatigue. A small cut takes forever to heal. Why is their body struggling with things that never used to be a problem? The answer may lie in a failing immune system, one of the most visible signs that the body is nearing the end. As defenses weaken, the body becomes more vulnerable. Infections that once came and went now linger. UTIs, pneumonia, skin infections, and even mouth sores become frequent, harder to treat and slower to heal. Even antibiotics lose their magic. Stronger meds are needed. Recovery takes longer, if it comes at all, and sometimes the signs aren't what you'd expect. Instead of a fever, they may seem more tired, or confused, or just not themselves. In fact, mental decline can be the first sign of infection in elderly people, long before physical symptoms appear. Another warning sign? Slow healing wounds. If bruises linger, cuts reopen, or bed sores begin forming, it often points to poor circulation, a body no longer repairing itself the way it once did. For families, it's tempting to fight back harder. More treatments, more hospital visits, more medications. But sometimes the battle causes more suffering than relief. And in this stage, comfort may matter more than cure. Keep their environment clean, hydrated, peaceful. These small acts of care can offer more comfort than any prescription, because at the end, it's not just about treating illness, it's about preserving dignity. Are these signs resonating with you? If so, drop a 4 in the comments to let me know you're still watching. And if you haven't yet, subscribe and hit the bell icon, because the final signs we'll cover in this series may bring the clarity and comfort your heart needs most. Is your loved one's breathing trying to tell you something? Have you ever sat beside someone and noticed their breathing just wasn't the same? Maybe it slowed down, maybe it became shallow, or maybe there were strange pauses, long moments of silence followed by sudden, rapid breaths. Could this be the body whispering something deeper, something final? Changes in breathing are among the clearest signs that life is reaching its final chapter. What starts as mild breathlessness can soon turn into irregular rhythms, mouth breathing, or strange patterns like Cheney-Stokes breathing, a haunting cycle of rapid breaths followed by eerie stillness. But it's not just the breath. Have you touched their hands or feet lately? Were they cold, bluish, or mottled? That's not just poor circulation. It's the body slowly pulling blood away from the skin, conserving energy for its vital organs. A quiet sign that the heart is no longer pumping with full strength. Even the simplest actions, talking, sitting up, or changing position, can suddenly leave them gasping. Some may cough more. Others might make gurgling sounds from fluid buildup in the lungs. And many stop sleeping flat altogether, propping themselves up just to breathe easier. It's easy to mistake these for minor illnesses. But often, they're not a symptom to cure. They're a message to understand. A message that the body is slowly letting go. In these moments, comfort becomes more powerful than treatment. A cool room, a few extra pillows, a humidifier, or even small sips of water can bring relief when medicine cannot. So, if you're noticing these subtle shifts in breathing and circulation, don't panic. Be present. Your calm, your voice, your presence is the greatest comfort of all. Final reflections. What will you do with the time that's left? Now that you've heard all 5 signs, ask yourself, have you seen any of these in someone you love? Unexplained weight loss, constant fatigue, mental confusion, or emotional withdrawal? Frequent infections, breathing and circulation changes. These aren't random symptoms. They're messages from the body, telling us that the final chapter may be near. They don't come all at once, and they often go unnoticed until it's too late. But now you know what to watch for. You're no longer in the dark, And with that knowledge comes power. The power to prepare, to care deeply, to love more intentionally, and to bring peace to the people who once gave you everything. This isn't about fearing death. It's about honoring life. So if you've recognized these signs, don't wait. Spend time, create moments, speak love, ease the journey. Because sometimes the most powerful medicine is simply being there. If this video touched your heart or opened your eyes, leave a comment below and tell us what stood out most to you. Your voice matters and your story could help someone else going through the same journey. Don't forget to like, subscribe, and share this video with others who may need it. Thank you for being here. We'll see you in the next one.